If you have a child who's involved in sports, chances are they'll suffer at least one sports injury. That is why it's important for parents to know what kind of sports injuries happen the most often and how to avoid them, how to treat them if they do happen. Those top 5 injuries are the subject of an interactive chat called Chalk Talk, presented by Baylor Medical Center at Frisco and Fox 4 as well. And Dr. Randal L is an orthopedic surgeon. He's connected to both the Frisco RoughRiders and the Texas Rangers. He's the headliner for tomorrow's Chalk Talk discussion with parents. All right, Dr. L, I assume you like the idea of keeping parents in the loop on kids' injuries and sports in particular. I assume that means that's not always the case. Parents aren't always involved in this.
No, not enough, Steve. I tell parents they need to look at as if they're their child's agent. LeBron has an agent. Michael Jordan had an agent. They looked after them. The parents need to be the agent for the kids. They're the ones that should know what's going on with the kids. They're the ones that should know how much practice they're doing, how many games they're playing, how many different sports they're involved in. It's their job to try to take care of that for them because the coaches aren't always able to do that.
And is that the same? I had kids involved in club sports, and those seem to be almost professional. It's a higher level of competition, a higher level of athlete, a higher level of coaching. Do you need to be almost more attentive because the athletes are more skilled or do the clubs take care of that?
No, the clubs really don't take care of it. That's still the parents' job to do that. And especially, there are kids now that are playing sports all year round. I mean, back in the quote-unquote old days, you had seasons of sports. You had football season, then basketball season, then baseball season. Now soccer players play all year round. Baseball players play all year round. Kids play multiple sports. They play multiple activities all the time. They're practicing more. They're playing more. So again, the parents need to be in control of that. They need to be looking after that.
And I know that's one of the subjects. I'll be there too tomorrow night. We'll talk all 5 of the most common sports injuries tomorrow and more. And I bet rest will be one of the topics we get into when kids can get some downtime. Tonight, though, let's get into one. Is there one sports injury that you think for our discussion tonight, every parent ought to be at least aware of tonight?
Well, I think the main thing we're going to be talking about, one of the main things tomorrow is overuse injuries.
Okay.
Overuse, again, as we've just talked about, kids are playing all year round. They're playing multiple sports. They're practicing every day of the week sometimes. They're having multiple games on weekends. And then they
go to a private coach and train.
And then they go to private coach and train. And then basically their bodies just can't handle the stress. And that's what an overuse injury means. They're overdoing it. They're overdoing it. They're doing too much than their body can handle, and it's putting too much stress on their tendons, on their ligaments. So we're going to talk about in shoulders, what's a little leaguer's shoulder, and how does a pitch count come in? How many days should you rest after you've pitched? We're going to go into soccer type injuries. We're going to talk about tendinitis. We're going to talk about how much should you rest, what type of cleats should you use. So basically we're going to talk about how to cut down on this overuse, overdoing it type things.
Love that. I like one of the questions I read, when should a young pitcher start throwing a curveball? I played professionally, had kids who played. I don't really know the answer to that. I'm looking forward to your answer tomorrow night. Are there some girl-specific injuries? I know when my daughter played club soccer, a lot of the teenage girls were blowing out knees.
Yes, most definitely. Girls have a much higher incidence of ACL injuries than guys do. If you take girls that play the same sports as guys, usually soccer and basketball, girls have a 3 to 5 times higher ACL injury rate than boys do. And we're going to talk about that tomorrow night. We're going to talk about some of the physiologic reasons that do that, some of the hormonal reasons that do that. And there's some actual treatments out there to try to cut down on that.
Some preventative stuff.
Exactly.
Okay, so we start tomorrow, 6 p.m., the SciTech Discovery Center in Frisco. This is free, but they'd like to get a head count if possible and hope you'll register online. Since it's at the SciTech Discovery Center, bring your kids. They're invited. There'll be refreshments, science and math type of hands-on experiences for kids 4 to 8 and 9 to 13. Older teens might like to hear some of the discussions with Dr. L and others. Get more information on our website, fox4news.com. And I wouldn't be doing right if I didn't ask you, how's Yu Darvish look, Doc?
Yu Darvish, I was out at spring training just a couple of weeks ago, and so far things are looking pretty good.
Very good.
Yes.
Everybody's excited about the season.
Yeah, he's definitely excited about trying to have him back this year at some point in the season.
Absolutely. All right, Dr. Randal L, thanks for coming in.
Thanks for having me.
I'll see you again tomorrow night, and I hope I see you folks tomorrow night too.
Thank you very much.